What's up guys, Dr. Houlihan here again, not doing a barefoot shoe review today, although I do have a new pair coming in the mail, so there will be a new review out soon. Today, I'm talking about who you should see for your foot care. Should you see a podiatrist, a physical therapist, or a pedorthist? The reason I started investigating this question is because I kept having patients coming to me with shoes that were recommended by their podiatrists that were horrible. The shoes were bad. They were bad for their feet. It was exacerbating their foot problems and making things worse. So I kept thinking, how could this happen? How could a podiatrist do this? What I do know about podiatry school is that it's typically a 4-year program consisting of coursework, and then depending state to state, they'll have to do a certain amount of residency after that, practicing surgical techniques and whatnot. But what I did discover, I want to show you guys one of the curriculums from Temple University, which is a pretty well-respected university. Looking at the curriculum, this course right here that you're seeing on the screen is the only course that had the word shoes or footwear in it, anywhere in the 4-year curriculum, right? So these people who are going to podiatry school, granted, it's a lot of schooling, but they're learning very little about shoes. There's only 1 or 2 courses maybe that they actually discuss shoes. What I did as well, I actually reached out to a couple of podiatrists on the internet who happen to be friends of mine on Instagram, and I talked to them and I asked them what they really learned about shoes in podiatry school, and what they told me was that they not only didn't learn a whole lot, but what they did learn was focus more on the maximalist shoes and the conventional footwear that comprises 99% of the market today, and it was all about stability and support and just kind of pumping these kind of shoes that are really not good for our feet whatsoever. Studies have shown that these shoes are awful. 80% of runners get injured every year, and something like 7 out of 10 people will deal with foot pain sometime in their life, so these shoes are not working out. So compare that to physical therapy school, where in me, unfortunately, I received 0 formal coursework regarding footwear selection, footwear modification, etc. Everything that I know, I have done hit the ground research using my own body as a test subject. I've been researching this sort of thing for, gosh, it's got to be 4 to 5 years now that I've been wearing these shoes and testing them out in different scenarios, different brands, different types of shoes, and just reading all the available research that there is. So I myself, what I picked up is not formally education in school. However, I would have thought that podiatry school would have been far separated from physical therapy school in the amount of coursework that they get regarding footwear. Turns out it's only like 1 or 2 courses maybe. Now, I'm talking about a pedorthist. A pedorthist is actually a certificate that you can earn, which could technically either be a podiatrist or a physical therapist or anyone else. You really just have to take a certain amount of prerequisite coursework. Then you have to do the coursework for the certificate, which is somewhere, I think, 6 to 12 months. And then 1,000 hours of practical experience, which I believe also amounts to like another 6 months. And then you get your designation as a certified pedorthist. So the thing with the pedorthist is that their curriculum is focused almost entirely on footwear and orthotics, footwear modification, selection, etc. And so the person who's going to have the most formal education regarding the subject is going to be the pedorthist. So there's a couple things to consider when you're thinking about whether to go to a podiatrist, a physical therapist, or a pedorthist. Number one most important thing is you want someone who is current on the research. If you have someone who's recommending shoes that are dinosaur shoes that no one has recommended those for years, and all of the available research currently is kind of contraindicating that sort of footwear, that's not the person you want to go to, whether that be the podiatrist, physical therapist, or the pedorthist. If they're recommending something that is no longer kind of generally accepted in the landscape of medicine, that's not the right person you want to be going to. Now, you should also want to go to somebody who you will never have to see again in your life. Let me explain what I mean by that. With my patients, every time I discharge someone, I tell them respectfully, I never want to see you again. That meaning, I have offered them some sort of long-term solution that will solve their problem and prevent them from needing to seek therapy for this problem ever again. So if you're having a situation where you're going to a podiatrist or whoever the case may be, if they're just giving you like an injection in your foot and they're like, come back in 4 weeks, we'll do another one. Come back 4 weeks, we'll do another one. Same thing is true, I've heard of chiropractors. My patients will tell me that they'll go, the chiropractor wanted to come twice a week for 6 months or something to get adjusted. Now, if you're having to get adjusted twice a week for the same issue, that's not really a long-term solution. They haven't offered you anything that is going to prevent you from needing an adjustment in the first place. Same thing is true of foot pain and foot sort of abnormalities and misalignments. If your practitioner is not offering you something that's going to prevent you from needing to seek care for this problem in the future, then that's not the practitioner for you. In terms of orthotic devices, I know that there's a time and a place for these sorts of things, and I'm not referring to like neurological conditions like cerebral palsy or like a post-stroke where they need an AFO or a KAFO to keep the leg in alignment and functioning while they walk. I'm talking about your run-of-the-mill, everyday foot pain sort of stuff. Stuff like plantar fasciopathy, bunions, hammer toes, calluses, this sort of regular thing that a lot of people will encounter. If you are using an orthotic device for this, you should be using it as a crutch, and I mean exactly like you would use a crutch. Let's say I sprain my ankle. I'm on a pair of crutches. If I go to the doctor and they tell me, you're going to need these crutches for the rest of your life, and if you're ever without the crutches, you're going to be in a lot of pain. That doesn't seem like an appropriate treatment for a sprained ankle, nor should that be the appropriate treatment for any sort of these regular foot problems that I kind of listed off. If you're using an orthotic and someone tells you, you have to wear this all the time, and if you take it off, you're going to be in pain, that's not a solution to your problem. That's putting a Band-Aid on a bullet wound. You want to prevent yourself from needing an orthotic device in the first place. So in summary, the answer to the question is not as simple as I would like it to be. If you have to do like a phone consultation or even like a one-time in-person consultation with a podiatrist, physical therapist, or pedorthist to see if this person is going to offer you A, a long-term solution, and B, some sort of research that has been done within the last decade or so backing up what sort of solutions they're offering you, that's probably the best way to go if you want to get the highest quality of foot care available. Let me also say this. Podiatrists are not always bad or always good. Physical therapists are not always bad or always good. And pedorthists are not always bad or always good. I don't mean to try to demonize any one particular profession. I just want people to get the adequate care that they need. I see way too often people coming to me with, since I work at a spine-specific clinic, people coming to me with back problems that they've had for years and years and years. If they tried different methods, different practitioners, different sorts of treatments, none of which have worked because none of them really offered a long-term solution. What you need is a long-term solution to your foot care, and for that you need to find the most qualified individual, and for that hopefully there will be like an about me or a bio on whatever website or the business they work for, but if not, go for a consultation, see if they know what they're talking about, and see if you think that they can offer you something that would cause you to never have to see them again. So that's my recommendation in terms of foot care and seeking out the right professional in order to help you out. I hope this information is helpful in some way. If you have any questions, comments, feel free to drop them in the comment section below. And as always, I'll have more content on the way soon. See you guys next time.